We're in skeletal 2. So in this lab, we specifically focus on certain bones. We're going to mainly focus on the skull and also the vertebral column, the ribs, and the knee. So in the skull, there are a lot of bones. You need to be familiar with these bones. Most of them are pretty obvious. The sphenoid, this is the one I'm going to show you where to find it. And in the sphenoid bone, you have the sella tussica. That's the center part of the bone. You put the pituitary gland. So let's look at the skull. So this shows you the different skull bones, and this is the occipital. So they have the foramen magnum. And in anatomy, foramen means the hole, and the magnum is the biggest hole. So that's the occipital bone. And they also show you the other bones. Okay, from the top view, you cut this open, and you found this is the sphenoid. So sphenoid is like a butterfly, and the center part is called the sella tussica, because in the brain is here, and the pituitary gland, that's your very important endocrine gland, sit right in the sella tussica. And this one is the ethmoid. Ethmoid is the upper part of your nasal cavity. That's the ethmoid bone. So when we talk about the nerve, your olfactory nerve will go through the ethmoid bone and go into your nasal cavity so you can smell. Now we go to the facial bone. So this picture shows you those facial bones. So know the name, be able to identify them. Next one, hyoid. So hyoid, that's the one in your neck. So neck, in this area, the larynx is all cartilage. The only bone you can find is hyoid. So it's in the middle of nowhere, connect with cartilage. Your vertebral column. So from the cervical, thoracic, lumbar to the sacrum, you have 7 cervical, and you have 12 thoracic, 5 lumbar, and 5 sacrum. And eventually you have 4 coccyx, and the tailbone fused together. Humans have very small, and some animals, they have tail, they have a bigger coccyx. So how do I memorize how many? I say you eat breakfast at 7, you eat lunch at 12, you eat dinner at 5, and you sleep at least 5 hours a day. So 7, 12, 5, 5. And now let's look at the ribs. You have totally 12 pairs of ribs. And the first 7 pairs, we call them true ribs. Definition is they directly connect to the sternum. So you have 7 pairs of true ribs. And the last 5, we call them false ribs. So you have true ribs, false ribs. And definition of the false ribs is they either not directly connect to the sternum, or they don't connect to the sternum at all. So that's the false ribs. And the last 2 pairs of false ribs, we call them floating ribs, because they don't directly connect to the sternum. They don't connect to the sternum at all. So that's the floating ribs. And when you see the boxer, they break the ribs, they break this one because they don't connect to the sternum, so they're structurally weaker, so they can be broken. Now let's look at the knee joint. So that's the knee joint. It's made of 3 bones, or actually 4, right? You have the femur, the tibia, the fibula, and patella. Patella protect your knee. So let's look at the ligaments. So you can find the 2 cruciate ligaments. The one you are able to see in the front called the anterior cruciate ligament, and the one in the posterior is the posterior cruciate ligaments. And these 2 called collateral ligaments. To identify them, you need to find, okay, which one is medial, which one is lateral. So this part is the medial, and this is called the medial collateral ligaments, and this is the lateral collateral ligaments. And medial collateral ligaments also called the tibia collateral ligaments, and this one also called the fibula collateral ligaments. Okay, that's it.